Hey everybody, this is Dr. John Petrick, and welcome to another fun and exciting episode of the Ask Dr. Jon Show. I'm here with Scott Kalb with EverReady Labs, and we're going to be talking to you today about a huge topic in pretty much in healthcare and wellness, and that is peptides. Now, a lot of people out there have heard about peptides, but there's a lot of misconception and a lot of things that people don't know. And today, Scott's going to be diving into them, and hopefully at the end of the interview, you're going to know so much more about a topic called peptides. So Scott, why don't you start us off for all the viewers out there and tell us what is a peptide?
Well, peptide is basically a derivative off of the growth hormone chain. Everything is taken out of the chain and amplified into a higher milligram to do a specific job. So if you were to take growth hormone as a whole, you would be getting all of those aminos in that would be taking care of how your body runs and works. When you have the peptides as a singled out product, they're normally amplified to a higher milligram and they are made to do a specific job. So at that allows you to fix a certain area that is either not performing the way it should be or that needs a little help.
And it's basically a protein with amino acids kind of wrapped around it. So if you were to picture that, it's a protein chain. It has amino acids wrapped around it.
Correct.
And basically what's happening is that we're kind of isolating certain proteins and amino acids to do a specific role. Now, in our office at EverReady Health, we utilize peptides for gut health.
Yes.
Weight loss, we utilize those for joint strength. Basically, you can find a peptide for just about anything. I've been known in cardiology, they're utilizing different peptides to regenerate some of the vascular system, veins and arteries using peptides. Why would someone want to use a peptide as opposed to, say, a pharmaceutical? Oftentimes it's an alternative.
Keeping it very simple. A peptide's very natural to the body. Again, it's all comes from the growth hormone chain. So our body's already producing that. With that being said, we have that ability you might be deficient in a certain area where I may not be, and you may need to take something where that particular peptide could take care of. With me, it might be completely different. I need to take care of a different situation that I might not be in a good spot where my body's not producing it anymore. So there is those peptides that are out there that people don't even know about that have very specific jobs. Like you mentioned about recreating blood vessels again and that kind of stuff. That's the AR290. That specifically that's what that product does. Creates more blood vessels to create more blood flow for healing, repair, all of those kind of things.
And there's a lot of peptides. We use BPC, which is Body Protective Compound 157, which we use that for our patients who are coming in with neck pain, back pain, even gut health. We've actually put patients on that have had ulcerative colitis. We had a patient who came in and we recommended BP 157 and they reported that they had great results. There's TB 500. Tell me a little bit about these two particular compounds and what you found that they benefit.
BPC 157 has several different working areas. You can do it as an injection, a sublingual, an oral pill. You could do it as a patch. But they have different areas when they go about that on how they work. A pill is actually going to work on gut health and joints. If you do it as an injection, it's going to work on, you typically want to go, if you're having a shoulder problem, you want to go around the shoulder area to work it. The closer you get to the area, the faster it's going to work.
So something like that, if you did an injection, you're going to work on muscle, tendon, ligament, and the articular cartilage of the shoulder or the knee or the hip.
Yes.
So you do an injection. But if you're wanting to take that body protective compound and you take it sublingually or as a pill, it's going to work in on your gut health.
Correct.
Even get down into that systemically through all the joints too.
Yes.
One of the things that as a physician, and especially working 25 years in pro sports, we're always trying to be on the cutting edge. And one of the first things we want to do is, one, we always want to stay legal, which brings us to that common question I get from a lot of patients ask me is this a steroid? And the answer is
no, not at all. Works a completely different receptor, a totally different part of the body itself. It's working more off of that growth hormone chain itself on how the body functions. Not more so on the hormone side where like your testosterones would, your steroids would. Completely different.
It's not anabolic.
No, not anabolic at all. It just has mostly you got healing properties, and you got testosterone being more of a performance or a well-being.
And in my history, again, in pro sports, having patients, primarily athletes, we're always trying to find ways, one, to get them healthy, to keep them healthy. And then when they are injured, how do we not only to get them back on the field, the court, or back on the mat, or the cage in that case, we're trying to find ways to bring them back to where they're healthy, where they're not having to always pop a big pharma or they're not on medication. So what we have found is a lot of the compounds we're using now, one, they're legal. Two, they're not something that they're going to be, pop a drug test for, but they're not just used for athletes. Anybody can get them, right? So it's one of those things with your company, with Accelerate Labs.
Yes.
What are some of the things that you see patients of all different shapes, colors, and sizes?
We actually see a lot of BPC, a lot of TB. We have that as blends where they're together as the same, to where it could be done as an injection at the same time instead of having multiple vials type of thing. When you have the BPC and the TB together, you're working with TB, you're working with muscle itself repair, and also ligament with that. So you put that with the BPC and they become what they would call out in the field now, it's called the Wolverine of medicine. That is you look up BPC online and there's nothing but good reviews of it. You do an injection, you had carpal tunnel, and you couldn't even put your thumb into your palm like that. You do an injection, into the arm area. Within 15 minutes, you're able to do that and actually do this without having that feel of, an ice pick feel going into the back of your arm.
And that's one of the things too, what I like in medicine, especially not saying that this is a regenerative medicine, but we don't really diagnose, we're basically treating symptoms. We're not diagnosing, we're not saying that we treat a particular condition. We treat the symptoms associated with carpal tunnel. We treat the symptoms of a rotator cuff strain and strain, or a tear, a meniscal tear, or a lot of times I've mentioned even with the gut health, a lot of patients who are on a lot of pills, we found that if they're having terrible pharmaceutical reactions or they can't take a lot of pills, or if they're taking pills, it destroys their gut. Antibiotics. Yes. Now, if you look at the number of people that are on an antibiotic, and that's what that's doing to the microbiome in their gut, when it just destroys it. And people don't realize it destroys the bad, yes, but also destroys the good. And now these people are left with their gut that can't, leaky gut. Which if you don't know what leaky gut is, if you were to look at the cells of the inner lining of the gut and what happens, it starts to open up and you can get toxins that leach out into the body. Yes. And now you're toxic, or you're basically become septic. So peptides are really good at creating that gut health and that gut lining. And one thing just to add on that is that we used to think and we're taught the brain controls the body. Now that's been completely a fallacy. Correct. We now realize that the gut controls the brain. As simple as if you're hungry, your body releases something called ghrelin. It stimulates the brain to say, hey, go eat. Yes. Right? So a lot of times, a lot of the conditions that we're seeing in a lot of our patients, even with the joints, Scott, that we're seeing that if their gut health isn't healthy, and their gut is all screwed up, it's going to lead to injuries, tendon tears, ligament issues. Correct. Leads to these neurological. So, you're somebody that's been in sports. You're pretty much, as you can tell, Scott's never seen the inside of a weight room at all, right? But Scott's in the weight room all the time, and you're not. I'm not criticizing here, beating up on you, but you're not a spring chicken. No. So one of the reasons why we were talking before we went on is that one of the reasons why you like peptides is it can keep us, and as we're aging, it can kind of keep us in the gym. And I'm not saying it's a reversing that, turning the hourglass upside down, but it certainly does slow down the sand. Yeah, there is a lot of peptides that people don't know about that are very good for us. There's one of the peptides that it doesn't get a lot of recognition is LL37. Okay. I'm not familiar with that. What is that one, Scott?
So LL37 is a peptide that works on the autoimmune system. So as we all know, we've been hit with the penicillins, the tetracyclines, all of those products as just a baby. We're immune to that stuff now. We get that prescribed to us for a cold, whatever the situation is, it doesn't work. Or we got to take it longer than what we should. And the reason why it's not working is because we're immune to it. LL37 is a peptide that actually works on the other side of that to where it can work on those problems that you have that we can't take care of now with the penicillins, the tetracyclines, any of those kind of products. And then you got a lot of people that are also, they can't take any penicillins. So it's a real good product for that.
Allergic or hypersensitivity
Correct.
to it.
The LL37 has actually been known to cure COVID. It's also been known to cure cancer. So it's a product that's great, just not a lot of people know about it. We have it. It's something that helps you build that immune system up. It keeps you healthy because of the fact that we're not being able to stay under that sick light all the time or allergy type situations because we can't take those products because they just don't work.
So it's a natural alternative to the penicillins and the antibiotics. And certainly we're
Correct.
not saying that, get on LL37 and you're going to cure your cancer.
You're right.
What this does is, and you can correct me if I'm wrong, this helps your body to fight off the cancer so that if you are developing, and one of the things why in the cancer conversation is, always want to remember, especially to the people out there listening, that it's always better to prevent a disease rather than treat one. So early diagnostics is something at EverReady Health we're always pushing, whether that be a full body MRI, the Gallery cancer screen, or any time that we have an opportunity that we can diagnose, find a problem at its young baby state so that it doesn't manifest into stage 3 and stage 4 where basically almost nothing will work. But when you talk about LL37 and its natural form and helping the body aid in the defense of these particular type of conditions, correct?
Yes. It makes it to where you might be going to see a doctor that's trying to treat something. He might be completely on top of it, but that medicine that he's giving you is just not working anymore. And it's not working because we're immune to it. So it makes it open for that story.
When you look at the number of pharmaceuticals, we're not going to spend all, this conversation on about beating up big pharma, but at the same time, right now, I always appreciate the bioidenticals. I always appreciate the natural remedies, the wellness portion, as opposed it's healthcare versus sick care. And that's a paradigm. And I always love this. Have you seen anything? Have you ever seen any contraindications to peptides? Because I don't know anybody, me personally, as a physician, I don't know too many people who have taken peptides who didn't like them and didn't notice an improvement. Anything that you'd want to comment on that?
No, if you read anything about any of the peptides that are out there, you're going to see there's nothing that's ever been, that I've even seen and been in this for a long time now, that somebody says that maybe it didn't work for them. That might be that worst that you hear. But it could be a situation where maybe they weren't taking enough of it or they didn't take it long enough or whatever that situation is, but you never hear anything bad. It's so natural to the body that you're giving your body what it really needs or might be depleted of. So it's not like you're using something synthetic, as far as, something that's more man-made.
Foreign to the body,
yes.
Yeah. And we were talking about this too. We always recommend getting the guidance of a licensed physician on this. You don't want to get it out of the trunk of the car. Go to a good company. Go to a doctor who's familiar with peptides. Like the physicians that I work with are very familiar with the peptides, and not just necessarily isolation, as you mentioned, BPC 157 and TB 500, and utilizing it in a combo so that you can get both. You can get the gut health and the joint health, and you can do that. So it's not something that you really want to kind of, you don't really want to bastardize it and kind of get it from anywhere. You want to use a good, reliable source like your company
Yes.
with Elevate, we want to use that, right? So
Yes. Yeah, it's you're going down a road where you want to make sure that you have a good product. We everything we have, we test. Everything gets tested. All the reports are there. You're getting a good product. And there's so many different kind of products. You want to do a lot of research on what you think you want to go after. To try to help yourself or whatever the situation is, whether it's weight loss or hair growth or, skin tightening and skin thickening and those kind of scenarios. Because there's a lot of products that do all of that.
There's actually a cosmetic aspect to this too, as far as with aging. You get the old chicken arms. As people get older, they get the saggy skin, and a lot of the times the peptides, because of the proteins and the amino acids that they encompass, they're really good for anti-aging, for the face, for the hair. You mentioned hair growth.
Yes,
that's something, and pain is the number one motivator, followed by vanity. So if you are somebody out there, it's good. You can get them. Do they inject them in the face, or is it you just take something? How does that typically?
GKCU is your main product.
GKCU. Okay.
Yes. That particular product is blue in color. When you get it, it's a copper peptide.
Okay.
So it's a metal. We're deficient of that. We don't know it. That's where your hair loss comes from.
Or graying.
Yes.
A lot of times people don't know that if your body's not capable of assimilating copper, that's what provides early graying or hair loss. So this is a copper derivative, or you will, a copper based protein or a peptide?
It's a copper based protein. It's the peptide that allows your hair to actually start growing again, like almost reroot, if you would. It also has a lot of properties of, and the reason why is because it rebuilds the collagen in the body.
Okay. So
now you're talking about growing nails, growing hair, growing thicker hair. One of the main things that particular one does is actually makes the volume of the hair, the diameter, thicker, and makes the root basically almost resprout again. So we have
so interesting.
Yeah, we have people that will actually take that as an injection, as a dose
in the
daily.
Scalp.
Nope, they'll put it wherever they want to put it. That's their choice, wherever they want to go with it.
Common injections, for instance, like when we do injectables for various different types of medicine, they do it in the glute. You recommend it kind of in a fatty area of the body?
The fattier areas are very typical for that kind of stuff. Yes. This particular product's very interesting because what a lot of people do is they'll mix it with a hair serum. They'll either rub it onto the head, they'll buy it, they'll mix it up, reconstitute it.
Like a subdermal, like a cream.
Yep, they'll put it on, and then they'll actually do a microneedling.
Okay.
So they'll microneedle the head and then again rub it into.
And that's one of the things we recommend, and one of the things we perform when we do aesthetics. We do lots of exosomes and stem cell procedures with hair growth. And we started to add the peptide formulas to it.
Yes.
Because again, it just aids in it. And it's like, there's that good, better, and best. And I've never had an athlete or a patient that I said, hey, you know what? We're going to shoot for bronze.
Yeah.
We're always shooting for gold. So we want, reputation. We always want our reputation to be the best in the business, and regardless of what we're doing for the patient, we want them to come back. We want them to be pleased with the performance of what we do.
Yep.
So we actually encourage them to do the peptides with the exosomes and stem cells for the regrowth, also for the face, because we're only going like 2.5 millimeters into the tissue and in the scalp.
Yep.
So you can do it with a micro needle.
Yes.
And you could actually, and again, I haven't done it this way, or our doctors haven't. We haven't. You could actually put it on and micro needle it right into the face, like you do a lot of your standard aesthetics type procedures, right?
Yes, you can even do that with the hyaluronic acid as well. Same kind of scenario. This one is really, really good. It's very popular because of the collagen that it rebuilds pretty much, because it's allowing your nails, it's allowing your hair growth, all of that stuff to come back in. they're actually using that in place of minoxidil.
Oh, wow. Okay.
So they're getting rid of the minoxidil because it was so kind of toxic.
Yeah, it's not good on the system.
It's not good.
And just real quick, he is actually 150 years old. So look how, I'm just kidding. I'm just kidding.
Yeah, I'm actually going to be 52 in about 3 days. So
you look great.
Yes,
I'm 52 now, and I always practice what I preach. So a lot of these things I utilize myself, and we encourage this. You know, one of the other things too, I wanted to kind of chat on and with you on this is that cost. You know, just to kind of let people out there thinking, well, this sounds so great, too good to be true. Right. I bet it costs a fortune. And we tell patients all the time that obviously there's different levels of things that you could get into, but the cost is reasonable. I didn't find that peptides were didn't break the bank. Yeah. Is that something
you do get very fast results, especially out of certain products like BPC. BPC, you can literally inject that into an area that's damaged. Let's just say, in the 15 minutes you have relief. It's non-narcotic. It's not a painkiller. It's nothing of those.
Not an opioid. It's right, non-addictive.
Nothing. And people are like, I can't even believe it. It's almost like witchcraft. That's what they tell you. That's exactly what you hear on the return. Like, we have a lot of pro athletes that use. Especially the BPC in the gyms, you get in a carpal tunnel, you get in a pulled muscle, whatever the case is, and going in and using those kind of products, and they're like the next day they're almost back in there again.
We hear it all the time.
Yeah.
I can't believe how much better I feel.
Yep.
And when you put the right rehabilitative protocols, we use active release and a few other type of treatments in our facility that really is great for the breaking up the fiber and tissues when you got a joint that's bad.
Correct. Yep.
We use active release, and then we add the BPCs, and then if needed, the exosomes and the stem cells. So we could layer this stuff on to deliver the best results in wellness and in sports management and stuff like that. But again, going back to it, the cost isn't crazy for peptides. Like, this sounds so good. You know, people are used to spending, and they're thinking, especially when we're in the regenerative medicine, because stem cells and exosomes can be pretty pricey,
Yes.
upwards to $15,000 to $25,000 done right.
Yes.
To do it right, because it's a lot of money. You don't want to do it wrong and waste your money. So
No.
I love to think that with Dr. Martin and Dr. Bruce and the doctors I work with, they're the top notch. So I know our packages are really kind of priced perfectly. But what I love is those layers of where I can add on the peptides for just a little bit more. You know, you're not going to spend thousands upon thousands of dollars for peptides, which is important. So that means anybody can use them. So you don't have to be a rich, football player, quarterback, or UFC champion like Conor McGregor to be able to use a peptide. So they're very cost effective, correct?
Yes, very, very cost effective. And they're being cost effective is almost, it's when the people come to us for what they need, it's not even a cost factor. It doesn't even come into play. It's just, how quick can I have it?
Yeah.
How quick can I have it? Because I already know what it can do. I've used it before. I need it. Like, how quick? So that's what you hear. You hear a lot of. My wife just had a hip replacement, and the doctor, great. He's like, use the peptides. You got them. Use the peptides. Use the BPC. Use the TB, and we did. And literally, like this, back on her feet, walking up steps.
Immediately.
No problem.
Immediately. And that's the thing too, is that recovery. We see this all the time. We do when patients have hip replacements, knee replacements, even shoulder replacements. When they're having this work done, one of the biggest problems that we have is the body heals too well and they get fibrotic.
Yes.
When you start utilizing these peptides, their recovery is so much faster and way more complete. They're not struggling. They're actually back on their feet. They're up the next day. They're doing the things they want to do.
Yep.
And I've seen major amounts of improvement with our patients when they're doing peptides post-op or pre-op.
Yes.
And not doing them at all. I mean, it's almost night and day in regards to the recovery.
And that's what we did. We actually did a full session of before, about a week before, started working into doing the BPC. And just because there was a significant amount of pain, because it was a bone on bone scenario. So we were working into that as the surgery was happening, and the doctor was Dr. Martin. He says, man, it's great. Like her results are like on point. She's moving way faster than what would be normal. And that reason why with the BPC, you heal 8 times faster. So every time that you do an injection, it's like you just grabbed 8 days of healing without no injury in between. Because that's our biggest problem. That's as healing as we get older, that time frame gets longer and longer for us to heal. So if you can heal 8 days just by doing one set of injections, it's allowing you to not have that injury factor in between that 8 days, which is great. So you hear people, they'll get it, they'll do a session in the morning, they feel great. They'll be able to use the arm, whatever the case is. Sciatic, great for sciatic. That's where I learned where BPC really came into play for me, is that because I had a bad car accident.
We talked about that before we came on. We were talking about what got you into it. And you said, hey, look, it was my own internal or my actual search, because I wasn't going to accept status quo. I wasn't going to accept the diagnosis of what they're telling me. So you found your own way into this, correct?
I found it in, epidurals and name it. Like I had it all done, and it was getting down to having major back surgery. And what people really don't know about BPC is that it pulls that inflammation out. That's the biggest thing. Getting rid of the inflammation is so big, because once you get rid of that inflammation, you're getting rid of that water around that problem. Yeah. When you get rid of that water around that problem, now you have circulation again. The more circulation you got, the more you can heal, the faster you heal. So you're back in the game quicker. And that's what we hear the most of is I have no more water retention on my knee anymore. Yeah. Whatever the case is. We hear, all the time when it comes to that. So it's real good. There's a couple of other products too that pull inflammation that go really, really good with BPC. It's called KPV. We're going to be bringing that in as well. That's another product that goes very, very well with it. We have, like I said, a lot of pro athletes that are, one of our guys, Travis Odermeyer, he's the world's strongest man. He's got world records. Yeah. He's got world records on an actual hip replacement. And he was actually talking to my wife over the phone the night before she was ready to go in. And he actually told her, he said, you're going to be back on your feet before you know it. And he says, this is what I used, and that was BPC, TB, and KPV. And that getting rid of that inflammation was huge. Huge. And
one of the probably for me as a physician, and I'm sure you feel this way too, it's kind of one of those things that, it's because it's a natural product. It's on the wellness side. Big pharma is not involved. So therefore they were trying to keep it on the down low for many, many years, not wanting this to get out into the mainstream. But listen, my patient, my consumer, they're smart. They're coming in and they're asking me about different peptides, and I have to go, hold on a second. And then I got to go through our library of peptides that we utilize. And one, it's not that we don't know it. It's just in what combinations to use. And again, you mentioned something that's really, really important is how it's administered. Based upon if I take it sublingually, or I take it as a pill, or I take it as an injection, those compounds are being injected differently. So our consumers are coming in really knowledgeable. I had a lady who came in, she had little vials. This was probably 10, maybe 15 years ago. She came in a bag and she had these little vials, and she goes, hey doc, you've ever heard of peptides? And luckily I had, and I said, where did you get all those? And she said, well, I have a friend of mine who's big into peptides. And she literally laid them on the table. And she said, I take this one for this. I take this one for that. And this woman was 65 years old at the time. Yes. She had muscles. She looked great. And she said, doc, I won't take anything else. I don't take a blood pressure pill. Yeah. I don't take any statin. I don't take any. And she just said, this is what I take and this is what it's doing. And I was so impressed, as she was a non-medical person, but she knew what she needed when she needed it. And I was like, wow. I said, you're going to come in and maybe, educate me, because she had so many, again, now I'm not encouraging everybody to kind of self-administer. What I am telling everybody, again, make sure you go to a trained, licensed physician. That's certainly what you can do. But this isn't one of those things what you have to necessarily be afraid of. You're going to notice a result almost instantaneously within a certain period of time that is exceptional. Those results are absolutely exceptional. And I recommend peptides all the time to our patients. And it's something now that we're going to be starting to implement in all of our treatment packages. In addition to our biologics, we're going to be starting to add the peptides. In addition to when you come in for us to rehabilitation, now we can start to administer them. And we find that, again, my number one concern is patient outcome. My reputation, my Hippocratic oath to do no harm, and my ability to heal people better than anybody on the planet is what I'm always seeking. That's what I want to do. It's my desire. So by adding these layers of success, I find that my results and my patient outcomes, I mean, they just far outreach what I was doing 20 years ago. And I thought, hey, I was the bomb, and now I'm realizing, how about this layer? How about this layer? And now you can't guarantee anything, but what I will tell you, again, to your point, every time I put somebody on one of these layers, the patient comes back and they say, I'm so much better, so much faster. And not only that, I'm setting PRs. And that's where guys like you that are out there in the gym, they're crushing these weights after almost severe back surgery, after all of what you've lived through. At 52 years old, he pulls off his shirt and he's got full on abs. We're all jealous. So
we listen, we enjoy what we do because we're helping people, A big game changer for the whole industry was the weight loss. Everybody wants to lose weight. Everybody's looking for the next diet phase.
Well, obesity is the number one cause of all-cause mortality. So, and you mentioned inflammation, and obesity causes severe inflammation, which causes free radical damage, and inflammation is really because of all disease. Every single disease can be linked back to some inflammatory process or some inflammatory state. And right now, look, we're doing a great job as a country. Finally, all 50 states, 50% of their population in all 50 states are obese. Wow, that's something to be proud of. We are one of the fattest countries. And let's call it for what it is. We're one of the fattest countries in the world based upon, we've been lied to about our diets, our exercise. We pull PE out of our school. So when you talk about weight loss, tell me a little bit more about that and some of the peptides you use for weight loss in particular.
So big game changer for everybody. Everybody was scared of an injection, a needle. The GLP-1s started really coming to life. The semaglutide, trizepatide, retatrutides, liraglutide, caraglutide. There's 7, 8 of them very easily.
Is this like an Ozempic or one of those types?
Like an Ozempic, Mounjaro, those kind of products.
Which have a downside to them, right? So that's where a peptide on top of that keeps the muscle mass, muscle growth. Samorelin. A lot of these maintain. So if you what we're addressing here is a lot of these GLPs, which is glycogen-like peptide. These compounds have a positive, you're going to lose the weight, but you also lose muscle mass. Your diet goes down when you're on these things. So the peptides help kind of on the other side of that is the bad side of it. That you add a peptide to it. Now you're kind of adding something a little bit more supportive, correct?
Yeah. So the Samorelin is a very good peptide because it's going to release the ghrelin. It's going to help you, kind of pick up a little bit of appetite. But you're going to be looking for good food. So what people don't realize, even with the GLP-1s, they're a product. All of them have a very distinctive way of overriding what you like and don't like to eat anymore. So it's basically telling the brain, it's telling the brain that you don't know what that tastes like, so you don't have a craving for it. If you don't know what it tastes like, you don't want it. So when you have that, that's just like they would use Wellbutrin for smokers. We've had people tell us all the time. They're like, God, I used to go home on the weekends, and me and my husband would go out, and we'd go out for drinks and go from place to place. And she says, I don't even have a taste for it now. Now I just go out and I just get a club soda.
And that's because of the receptor sites. It blocks that receptor site that you used to want and created that craving, and which is really interesting because when you're looking at the weight loss, and I always tell my patients, and this is one of the things we look at, is that how is the state of the human that I'm treating? Correct. If they're coming in and there's levels of obesity, but if they're coming in and let's just say they're based upon the American Medical Association and the guidelines they use, which I don't necessarily believe. when you look at the guidelines in the health and recovery, and I have patients that come in overweight and they're like, they want to get, oh, I want to be out of pain. And I'm like, well, first and foremost, your body's diseased. Yep. This obesity is one of the worst things and worst states that you could be in. Is you're showing up right now in my office, you're showing up obese, and you're asking me to fix your blown knee. Yeah. You're asking me to fix your torn shoulder, or you're asking me to fix your back. Yep. Until we address the underlying cause, all time, the worst scenario is obesity. Until we address that issue, how could I ever get you completely healthy or provide you with true wellness? We have to address that. It's something you can't ignore.
Even with the obesity, it's one of those stories where, again, there's a peptide specifically for that. Like, it's a spot injection area. It's called AOD 9064. That is the part of the growth hormone chain to where if you were to inject growth hormone wherever you put it, they would tell you that it would eliminate the fat in that area. It would eat that fat away. That is one of those peptides right there. Since we're talking in that area, that's one of those peptides that actually goes in and it works on that fatty area and breaks that fat down and allows that water to release out of it and starts breaking that fat down. It actually speeds up the process as if you were in
lipolysis. The process of breaking down fats called lipolysis.
So like a 3 or 4 week boost right out of the gate by doing it. But going back to the GLPs, there's so many of them that are out there now. The half-lives are longer on them. They have them now to where in the beginning nobody wanted to hear anything about a needle. So peptides weren't really as popular as they are now because of that. Nobody wanted to hear about that. Then they realized that they could do one little shot a week of a GLP. And
we're talking small needles. We're not talking the horse needles. We're talking tiny, almost like a diabetic needle, right? Real thin,
very thin,
very non-painful type procedures. And we recommend patients come in because we try to compound everything together. Come into our facility, and we'll administer for you. You don't need to be there. And once we get you to a targeted weight, then you can kind of do on your natural glide where you're now you're kind of smoking through it in a sense where everything's cool. We've got you down. We've got you out of the disease state of obesity, or we've got you down to a weight that's tolerable. But none of this, it's all one of the things we always recommend that's so important is proper diet, proper exercise, proper mental state of being. These are some of the things that coincide with the peptides, with the GLPs, with the Somorlins and all of this stuff. You got to pay attention to what you're putting in your body. And this is one of those things that can help, correct?
Yes, the GLPs, you really are requiring a good diet, to make them, not make them work. You could be on that lazier end of things and take the shot and you could lose a lot of weight. But it kind of gears you and steers you in the direction to where you want to eat right, whether it's, chicken and rice, steak and rice, steak and potatoes, those better foods for you.
Better choices.
Getting your fiber, getting your fiber in, getting in everything that you need. It steers you more in that direction. And one of the biggest things with some of the GLPs, they can make you kind of nauseous.
Yes, I've heard that. You get sick to your stomach if you're on a GLP. I've had people who have taken them and the next thing you know, their doctor, they get like a flu-like symptom and their stomach is upset. Yep. So there are things with peptides that you can do to kind of, I don't want to say reverse that, but kind of keep that from happening, correct?
So you want to eat protein when you're feeling that. Like naturally, you say to yourself, you don't want to eat when you're feeling kind of nauseous. But eating protein that's your ticket to getting rid of that nauseous feeling. B12 can be taken 1,000 micrograms a day. If you need to take it, by pill that way.
We always recommend like a methylated B vitamin for our patients due to the methylation process. And that's a whole nother conversation. But we always recommend a vitamin. We do IV infusion. So for those people out there that are not wanting to take a vitamin, we do actually do a Myers cocktail, and we give people that in addition to the recommending the peptides and the GLPs and things like that in our office. We'll do an IV. And that way we know that they're getting all the vitamins and minerals that they're needing at that time.
Correct.
And then we, in addition to all these other things too. And one of the hardest questions, Scott, and that's a whole nother podcast for another show, is diet. I'm a big proponent of a higher protein diet, getting away from it. I say, and people think I'm crazy when I say this, stay away from anything white. White bread, white rice, get into more of the healthier, get into the yams and the sweet potatoes, get on the higher protein diet. I love the protein diet. I'm not saying go crazy like Jordan Peterson does the Lion diet, which is pretty much all meat and that's all that he eats. But I like the balanced diet. I like almost like a Mediterranean diet. Is there a particular diet that you've seen that works better with, with these proteins or peptides?
The peptides I don't really take because it's kind of countering what we try to do.
As far as the bulk.
Yes. The GLPs, the first place it's going to take from muscle.
Right.
Then fat and water. So for us, it's a little bit counter of what we would want to do.
And when you're saying us, Scott, you're talking about people that are wanting to bulk, the bodybuilding type.
Yeah, the bodybuilding.
Right. So why would you need a BLP? Your diet is already right on point.
Yeah,
you're in the bulking system, but for those people who aren't, then you are recommending the GLP so they can start to lose the fat. You take the peptide to maintain the muscle, and then you get on a well-balanced diet and stay away from the complex carbohydrates.
Correct.
No more chips, no more ice creams. Get away from that stuff. And as you said, the GLPs, they kind of take away your hunger and desire for that. So
yeah, and the way, when I say the way we eat, we're around a lot of other, pro athletes and stuff like that. It's just the way our lifestyle is. It becomes nothing but chicken and rice.
Yeah.
Jasmine rice. You buy it and buy it and buy it. It just keeps coming. But there's always a pot of rice, ready to go. But that's kind of the way we eat. But it's very simple. It's a very simple diet.
Real quick, just to touch on that, when I was doing weight cuts for a lot of my UFC fighters and a lot of my wrestlers and the people, my show performers who had to get on there, they had to cut. One of the hardest things was flavor with diet. And that was one of the things we did. So I work with the company and we sell their product, Avalon Meat Candy, which is jerky, beef jerky. And the reason is that everybody cooks their meat a little different.
Yeah.
You go to this person likes it rare, this person likes it well done. And when you cook it and the way you cook it, you cook out a lot of the nutrients.
Yes.
And so couldn't tell. So we went with the jerkies because of the various different flavors and out of the, and we are the official beef jerky for the Hawaiian Islands. We won first prize with our beef chips.
That's great.
Now you're seeing the carnivore chips I saw out there and I'm like, man, we did that first.
Yep.
We had something that was we call it a feather jerky where you could actually look through it. If you ever look a potato chip and saw it, if you saw our beef chips, that's what they are, and they're thin. So we always promote that. But I know it's been a wonderful show, Scott. Thank you so much for being here today and explaining peptides and the various usage, the various ways that you can take them in the various areas of the body. It's great wellness. If you are not familiar with peptides or you want information about peptides, reach out to me, Dr. Jon Petrick, on the Ask Dr. Jon Show. You can DM me, find me on social media. Check out my website at drjonpetrick.com. That's drjonpetrick.com. Give us a call at 702-948-2520. Once again, it's Dr. Jon Petrick, and I'm here with Scott. We're talking about peptides. Thank you so much for spending time with us today. And so thank you so much for tuning in today to the Ask Dr. Jon Show. And we'll see you next time. Thank you.